joining. Thank you for joining us on our National Town Hall on COVID long hauler syndrome. The NCNW Health Equity Committee and COVID-19 Subcommittee and Affordable Care Act subcommittees are pleased to bring to you today the National Town Hall discussion on COVID-19 long hauler syndrome. The National Council of Negro Women is a Washington, D.C. based charitable organization making a difference in the lives of women, children, and families through a four-pronged strategy that emphasizes entrepreneurship, health equity, STEM education, and civic engagement. Thanks to our partnership with Resolve to Save Lives, these videos that you just seen previously and additional materials will be available to you at other events. NCNW is committed to empower, inform, and uplift Black and Brown communities. As such, the Health Equity, COVID-19, and Affordable Care Act subcommittees have designed a town hall to discuss how chronic medical conditions place a greater risk of severe outcomes from COVID-19 infection. We will discuss COVID-19 long hauler syndrome and how it diminishes the health status of individuals in the African American and marginalized communities. We will also discuss the link between COVID-19 long hauler syndrome and the Affordable Care Act and how it is a challenge to identify the most consequential long-term complications from previous infections from COVID-19. We also have an arsenal of community resources that we will share with you at the end of this town hall. Just some statistics about long haulers. Patients with post-COVID complications are referred to as having long haul COVID, long COVID, or post-acute sequelae of COVID-19. Many patients recover from COVID-19 within a few weeks, but some still exhibit persistent or new symptoms more than 4 weeks after being first diagnosed. Everyone needs to continue to teach and reinforce everyday preventative actions: wash your hands, wear a mask, and socially distance. Thank you and enjoy this town hall.
Good evening. I'm Zenobia Moss, Project Manager for the Good Health Women's Immunization Networks with the National Council of Negro Women. We are delighted that you are able to join us for tonight's National Town Hall in collaboration with the Good Health Wins Network. A very special welcome to our network partners who include our NCNW sections, our state leaders, our national affiliate partners, our national partners, and our partnership with the National Panhellenic Council. Good Health Wins has received a grant, a partnership through the CDC, partnering with national organizations to increase vaccination coverage across different racial and ethnic adult populations currently experiencing disparities. We have over 30 national partners who are working with us to help reduce health disparities, to increase vaccination opportunities, vaccination education, and to help identify the drivers of vaccine hesitancy. It's through programs like this tonight that we want to engage our communities as trusted messengers as we build out this network of national and local partners to talk to our community residents about COVID, about the importance of immunizations across the lifespan, and especially around health equity. We are delighted to have with us our program officer from the CDC who works with us in securing both this grant and making sure that we are able to fulfill our responsibilities in it. We have tonight as our moderator, Dr. Jonetta Kelly. She's been with the CDC for over 17 years as a public health advisor and is a health professional with over 17 years in public policy, communications, and community capacity building. She is partnered with engagement and is committed to community engagement. She can tell you more about herself, but we are just so excited to be able to work with her and to have her as our moderator for tonight. Ms. Jonetta Kelly.
You're on mute, Ms. Kelly, Dr. Kelly.
While we're waiting, if you all could please indicate into the chat your name, your organization, and we will have that for our registration. And we really thank you and appreciate for the work that you're doing in communities all across the country. We selected tonight's theme, COVID long haulers and the Affordable Care Act, because we want you all as individuals, as trusted messengers, to really understand the depth and the breadth of what COVID long haulers are and what the syndrome is, and how so many people who are surviving COVID are dealing with it. And we also want you to understand, and we're so delighted to have folks from HHS here to talk about the Affordable Care Act. Ms. Kelly, are you with us now?
Can you hear me now?
Yes, thank you.
Okay. I'm sorry, I have to use two devices because my internet connection is not working well with Zoom right now. So here I am, and here I am. But thank you for the warm introduction, Zenobia, and it is an honor to be here with you all today. Again, I'm Joynetta Kelly. I've been working with the CDC and federal and state government. And I am really happy to be here today with you all to, talk about something that everybody wants to know about, which is COVID-19 vaccinations and long haulers syndrome. It's something that's at the forefront, especially with the news, with everything happening. It looks like every week or so there's a new thing that's coming up. So it's really good to be able to share the platform with you all and to introduce some of the experts in the field who I'm so happy to bring to light for you today. So I'm just going to start off introducing our wonderful panel. And this is in no particular order. First, we have Veronica Moore, who is also currently serving as the U.S. Department of Health and Human Services Regional Office of the Secretary in the Intergovernmental External Affairs Division, Region 6, which is in Dallas, Texas. She currently leads the efforts in the office. She deals with the community and HHS initiatives and also social issues for the past 20 years. Ms. Moore she's worked previously for the Centers for Medicare and Medicaid Services in the Division of Health Plan Operations. We also have with us the wonderful Dr. Freda Fisher. She is a physician who has been triple board certified in nephrology, internal medicine, and pediatrics. She's the founder and president of her own practice in Midtown Atlanta, which is called Midtown Atlanta Nephrology PC. She is the medical director of a nonprofit dialysis unit, and she is very happy to be here today. Let's see, we are moving on to, sorry, computer is frozen. Okay, here we go. All right, we're moving on to Dr. Tamara Mccants. She is a Brooklyn, New York resident, and she is a doctor of pharmacy, graduated from FAMU, and she came to Washington, D.C. to complete a community pharmacy residency program with Grubbs Care Pharmacy and Howard University. Dr. Mccants is currently the Director of Residency Programs and Practice Transformation at Howard University College of Pharmacy, and she is an advocate for the profession. She's an active member of several pharmacy organizations on both local and international levels. All right, we have a few other speakers here today whom I have to, I'm going to ask them to briefly introduce themselves due to my computer freezing up. This is the virtual world, and my apologies to the rest of you who I cannot introduce because my computer is frozen. So with that, I'm going to ask Dr. Jackson.
Yes, it's not Dr. Jackson, Sharon Jackson. I am a public health practitioner. My experience has been focused here in Washington, D.C., in the federal government, primarily with the Department of Defense, but also with the State Department. And I will be sorry.
Everyone, please mute.
Cannot. And I will be talking about the resources that we've put together, which address the issue of health promotion and prevention, and we hope you find them useful. Thank you.
Thank you so much. And let's see.
Yeah.
I believe we have introduced all the panelists. I'm sorry, Dr. Brooks, Dr. Oliver Brooks.
Chief Medical Officer, Watts Healthcare Corporation, member ACIP, and past president NMA. Thank you.
Thank you very much. Our apologies for that. So we will just go ahead and get started with the conversation. Again, we're really happy to have this conversation with you all and present this, especially with such a wonderful audience. And we hope to have some robust conversation coming from this. So with that, we want to start this off with Sharon Jackson. And again, my apologies, my screen is literally freezing before me.
I'm a come just interrupt 1 second. We're going to start first with Dr. Oliver Brooks.
All right. Well, good evening, ladies. Thank you, Dr. Elgin, Dr. Kelly, Ms. Moss, and I'm honored to be speaking to the National Council of Negro Women. I left out couple other things in my introduction. I'm a graduate of Morehouse and Howard, got to represent that, and Kappa Alpha Psi Fraternity Incorporated. So just have to endorse those three areas. So I'm just going to give specific information in my perspective on long haul COVID. I want to thank the National Council of Negro Women for doing this, because when I did my research, I found there was a lot more going on than I had even thought about. So I'm going to start with a brief story of a Black woman in Baltimore. Her name was Shamir Smith. She didn't know what's going on when she was sick. This is April of 2020, a year and a half ago. She said, now I'm a poor Black disabled woman living with COVID. First, she felt sick. She went to her doctor to get tested. Her doctor said, you got a sinus infection. She said, I never had a sinus infection. They wouldn't test her. And then she ended up just being sick, feeling sick. She went to hospitals for symptoms, but she felt like she was treated like a child. She was treated inappropriately. And ultimately, she said, this is the thing we got with COVID. We have to live with this. We have to navigate the system on our own. We have to become masters of our own body. And I just thought that was such a poignant way to look at it, because beyond everything else, being Black, that's the way we get treated as patients. So it is important that we address this from the perspective of African Americans. The experts can't say that there's a higher incidence or more problems with long haul COVID with African Americans, but the researchers suspect it is likely, given we are among those most harmed and hit by COVID-19. In fact, a quote from Dr. John Brooks, the CMO, Chief Medical Officer at CDC for long COVID, acknowledged both the dearth and demographic information and the likelihood of disparities doesn't even exist. While we don't have clear data, we really believe there's likely disproportionate effects. So we don't know yet, probably getting closer now to knowing. So let's look at some of the basic manifestations. Fatigue, breathlessness, cough, nonspecific chest pains, palpation or dizziness, brain fog, abdominal pain, muscle aches, hoarseness, skin lesions, and mood swings. So these are the things that you see. Generally speaking, long haul is considered to be symptoms that are occurring 3 to 4 weeks after the resolution of your COVID. 11 million in the United States now with long hauler syndrome. And it is felt to be strongly influenced by cultural, social, economic determinants of health and discrimination. So I just want to touch on 4 general policies or points that I believe make us more vulnerable and having more of an adverse outcome related to long haul. Economic barriers. The cost is for after COVID, if you're having problems, is somewhere around $4,000 per person. And vulnerable populations facing long haul have lower health insurance, lower rates of health insurance. Black and Latinx people tend to be uninsured and live in states where the American the Affordable Care Act was not expanded. So there was mention about the ACA. So we're living in those states where the governor said, no, we don't need it. So we're uninsured. It costs a lot. And so we are disproportionately impacted kind of on the national level. And secondly, it's debilitating and disabling in terms of blocking our ability to work. So we have less income, we get paid less, then we can't work. So we have little to no income, then we have difficulty getting on disability. So there is that economic burden or barrier. Second, geographic barriers. People living in medically underserved areas, which include a disproportionate number of African Americans, may have inadequate access to primary care. And I'll make a point about primary care because that's very important. Yet these vulnerable groups also have more comorbidities and a greater need for care. Poor public transportation may delay vulnerable groups' access to care, even when the care is available. So that geographic, tie that in with transportation, we're at higher risk for issues with long haul syndrome. Housing and segregation, number 3. Vulnerable populations tend to live in high density and crowded residences, which are associated with an increased risk of COVID-19, and residential segregation underscores, underlies, and exacerbates these inequities. So reflect back on the basic concept that if you're more likely to get COVID, you're gonna have a higher percentage of those people getting long haul syndrome. And then 4th, occupational barriers. So vulnerable groups such as us are disproportionately represented among essential workers, such as bus drivers, CNAs, working food service, food preparation. And those in that situation whose environmental conditions place them at higher risk for acute COVID are also going to be those that are going to be at higher risk for long haul. And because of those jobs, therefore, will be less likely to, again, be able to access services. So in looking at it, I found 3 ways to approach this, or 3 things to consider. First, as I had mentioned, strengthening primary care services. We have more underlying conditions because we just don't go to the doctor as much because we just don't have access. We refer to the doctor as to Dr. Smith. When I'm with my cousins in the South, they always speak to their doctor by their name. When I'm out here and then where I work, which is in Watts, it's the doctor. So we need to have that relationship. There's research that showed traditional primary care, first contact, holistic, person-focused, comprehensive, continuous, and coordinated saves lives, reduces suffering, and lowers overall health costs. So having that doctor that you're connected to is very, very important. Effective management of long-haul COVID requires the recognition of this condition and empathetic validation of the patient experience. That's having a relationship with your doctor. So that's very important. 2, high quality data and a learning health system. So I'm sure that Dr. Kelly could speak to that or understand the concept of data. Data now is everything as we've gone into COVID and are working our way through COVID. Unless we systematically measure inequalities by race and ethnicity, we will remain invisible. The information will remain invisible. And poor outcomes in some groups will be attributed to biology rather than the structural determinants discussed, as I've mentioned them: poverty, overcrowding, geographic underprovision, barriers to access, and systemic racism. So we need the data. That's how you make your argument, with facts and figures, and then accurate, focused advocacy. And then thirdly, addressing the social determinants of health in the US. We are notorious worldwide for high-cost, profit-oriented healthcare, which is marked by inequity and poor outcomes. We're like 37th on the list of overall health outcomes, but we're number 1 on the list by a wide margin on spending. So social determinants of health and a focus there, and also around the world, as you all know, universal healthcare is the standard, is the norm. Every first world country, every westernized country has universal healthcare. So what happens without universal healthcare? We are the ones that fall between the cracks. And then when you have these non-specific symptoms, like long haul COVID, then you're going to fall through the cracks even more. So the structure of the insurance just leads to racial and ethnic minority poor misrepresentation in the healthcare environment and poor outcomes. So what do we do? So in conclusion, I don't even know where my time is. I hope I'm not over or under. Overall, COVID long haul COVID disease is shifting from like a chronic acute condition to a long-term chronic health condition for the 11 million people that have it. Either you get COVID and either you get better or you don't, or you die, or you get better or you don't. And so for those that have long haul, these are the things we need to look at. First, primary care providers need to understand, recognize, and engage with both the clinical and the wider aspects of the new condition, the socioeconomic and the understanding of their patients. Second, health services must be strengthened at that population level to respond to this rapidly growing need and develop the expertise and the capacity to handle these 11 million and growing patients, a lot of us. Third, high quality data. We have to have the data so then we can understand where to put our focus. Fourth, access to resources. We need to be able to access the resources to get our people, to get ourselves treated. We need to view it from the longer term, that we need to look at it, that we need to think about this being around for decades and having an appropriate approach to it on the advocacy level. And then once we figure all this out, we need to think about this on a global level, because our brothers and sisters globally are going to be suffering just like we are here in the United States. So I would close by saying long hauler syndrome is complex and challenging, but it is real, and collective action and advocacy is indicated. And town halls such as this by National Council of Negro Women are going in the right direction to addressing this issue. Thank you.
Thank you so much, Dr. Brooks. That is informative, and you hit so many issues when you talked about social determinants of health and inequities and access. And most importantly, looking at this as a long-term issue, driving the point in about making the decision to get vaccinated. Vaccination is a personal choice, and it's a very important choice that you make for your family and for yourself. And, when you think about the conditions, the symptoms of long haulers, and just looking at the video and just really putting it in perspective, I know that brings an extra layer of information so that a person can make the best decision for their family. So thank you so much for your insight. We appreciate you and everything that you're doing in this fight with COVID. So we are going to transition on to our next speaker, and that will be Dr. Freda Fisher.
Hello, hello. Thank you, Dr. Kelly. Dr. Brooks, you really just hit on so many just key points. But I do want to say, I'd like to join the HBCU shout out train, if I may I? So you graduated from Howard, from Morehouse. I am a very proud graduate of Meharry Medical College. And I'm very excited because health equity, Meharry, is where I really got my foundation in every rotation and everything that we learned clinically, paying attention to the health disparities, both the overt and the covert, have been key. And those have been the driving forces in my career choices. So in my career choices, so I am a medical doctor who has been triple board certified in nephrology, internal medicine, and pediatrics. And I think sometimes when people hear that, they're like, you know, what is her issue? Does she not have a life? But actually, when I first started out after graduating from Meharry and I went to Georgetown to do my med peds residency, it was my initial plan to be a good old rural primary care doctor, taking care of the adults, the kids, and living happily ever after. But when I did my first nephrology rotation, that's when I really got a red flag about health disparities, which certainly will lead us into today's discussion. I saw that when I would go to the dialysis units where the patient's kidneys had failed, it was over 90%, almost everyone in those units, Black, African American. You also had people of color. But then when I would go to the transplant units where you had the life-saving kidney transplants, the decreased morbidities, decreased mortalities, and the real happily ever after for a kidney patient, almost no patients were Black. And so that's what led me to go on into nephrology, because we had health disparities. And then when I learned that the top 2 causes of kidney failure were number 1, diabetes, number 2, hypertension, who has those illnesses, who has those comorbidities disproportionately? Black people. And so my whole adult life, my whole medical life has been dealing with those disparities and trying to put in the education. So now here comes COVID-19, here comes the pandemic. And as we started learning more and more about who was more susceptible to COVID, who was more susceptible to COVID-19, who was more likely to get hospitalized, who was more likely to die, patients with diabetes, high blood pressure, kidney failure, so forth and so on. And here we have it, the health disparities just keep going. So we look at long haul syndrome, and Dr. Brooks has already outlined it beautifully. But when we look at the care for long haul syndrome, I know that in Atlanta at one point during the first wave, we had 70% of our hospitalizations were Black people, 18% were white. But then when you started to look at these centers, which were designed to take care of patients with long COVID, those were not the percentages. They still are not the percentages. And why? Again, you have the disparities. In order for people to go and to get care for long haul, there have to be so many things lined up. One, if you are a person who has a challenged socioeconomic status, which many Black people do, you're going to have a place with a pretty close geographical location. And so while there are many now, I know like over 60 long haul COVID care centers, many of them are in academic centers, or they may be in places that require patients to drive an hour. Well, if you don't have a car, if you don't have a lot of money, if you are a frontline worker who has to go and put groceries on the shelves, or a frontline worker who has to, drive the trucks, if you cannot take off of work, then it is not feasible for you to go and drive an hour or even a half an hour, or even to miss a day of work. So what happens? You may have long haul, but not get that proper treatment. And so I'm really excited about what we're talking about today as far as that coverage, which will help to decrease the gap. The other thing, there's a word that we keep using, that Dr. Brooks, you kept using, non-specific symptoms, right? Non-specific symptoms of long haul. Well, already historically, we know in this country, Black people's symptoms are often not taken seriously. Our pain is often just devalued or kind of dismissed. And so we don't get the same pain management. A lot of times when we express that we have a problem, if we have one issue, that's allowed to overshadow the rest. I'll give an example. Obesity. Yes, Black people are often disproportionately affected by living with obesity. So you can be a person with obesity and many other very real symptoms and medical problems. But in many cases, physicians will just blame everything on the obesity singularly and not really take the complaint seriously. And what does that do? That creates a situation of mistrust for the Black community, and there's distrust, for the medical community. So now take that and transition it to the long haul. You're complaining about different symptoms. You may have fatigue, you may have shortness of breath, you may have a rapid heart rate, you may have just something that just really doesn't seem to make any specific sense, brain fog. What is that? Well, if you have long haul, you know what it is. But if you're trying to express yourself to a doctor and you don't necessarily have that trust, that communication, then you can go in with all these non-specific symptoms. You don't feel like you're being taken seriously. Well, guess what? You won't get the proper treatment. You won't get the proper treatment. And there you have it, the health disparity now, again, with Black people in long haul. And then let's just say you do have a good communication and you do feel like you'll be taken seriously. Even if now we have this expanding insurance coverage, we have to have the education, which is why I'm very excited to be here today with the NCNW, because we have to get the word out. Because I can tell you right now, if I go to a lot of my patients right now and I talk to them about long haul symptoms and, hey, are you getting treated? Many of them will kind of probably tune me out because they don't know. And so part of the work that you're doing here today, that, you know, that all of us speaking, it's really helping, is getting the education out so that we can make sure that those of us who are most affected by the long haul, Black people, are able to get the care. But another thing I want to touch on in thinking about long haul and health inequities and disparities, I like to take it on back to my dialysis patients yet again, and just kind of outline from my perspective just how this COVID-19 pandemic has put us in this situation. When we first got told that we needed to shelter in place back in March 2020, doesn't that seem like forever ago? Oh my gosh, right? Back in March 2020, a lot of us were able to shut down our practices, do some telemedicine, stay at home, you know, do virtual school with a house full of kids. You know, you never thought you would spend that much time with your children and your puppies, but all of that happened. And we had that luxury, many of us. But then I look at my dialysis patients. They never had the luxury of sheltering in place because their lifeline was in that dialysis unit. So we say shelter in place, except for you dialysis patients, which of course, again, are mostly Black people. And so that put them at a higher risk for getting COVID-19, which many of my patients did. The other thing, you're supposed to socially distance. Well, if you take public transportation to dialysis, you're shoulder to shoulder, right? Inside of the MARTA or whatever public transportation you're taking. And so again, everyone else gets to stay at home. Everyone else gets to socially distance, not the dialysis patients who, again, are disproportionately Black. The other thing, we say, put on your masks. That used to seem like quite a simple request, right? Well, if you take a dialysis patient, anyone who knows how dialysis patients function, you'll see that most of them don't make urine by the time they get to end-stage renal disease. What does that mean? When they're going to get their treatments, they're full of fluid, and sometimes their lungs are full of fluid and they're short of breath. You try telling a dialysis patient who can't breathe because their lungs are full of fluid to keep a mask on. So that's just another layer. They're in crowded transportation, they're leaving the house, they can't stay home, they're shoulder to shoulder, and a lot of them are wearing the masks down as chin guards. And so I just wanted to kind of highlight how the health disparities that start maybe in one singular place, like just diabetes, just high blood pressure, then lead to kidney disease, and then lead you to being vulnerable to COVID-19, which then leads you to being vulnerable to long haul syndrome, which is where we are today. And so, you know, so that's talking about the barriers, that's talking about where it all began, but I'm especially looking forward to the rest of this conversation so we can talk about where it can hopefully end at one point, and it's going to end, or at least be contained or managed, by making sure that everyone understands that they now do have access, and finding out how to make this access easy. And you know, we definitely need to look at all kinds of layers, not just having the ACA help, also making sure that people who don't have smartphones or who are not internet savvy, that there's some kinds of resources. And then we already talked about the resources that will be shared today. So again, I'm very honored to be here, and communication is the key. Communication is the key, making sure that you have physicians, healthcare providers, and healthcare teams, people you trust, people you value. And you understand that those physicians, healthcare workers, healthcare teams, you understand they value you as well. And as we talk about communication, I do just want to share a personal resource that I'm very proud of, and that's my YouTube channel, Dr.Freda, which now I'm excited to say has over 360,000 subscribers. And when I started it, I didn't know that it would grow to that. But my point in starting the YouTube was very much to make sure that I had medical information in layman's terms, spoken to people who look at someone who they can relate to. And there are all kinds of healthcare topics where in every video, not only do I share what's going on with the medical topic, but I also want people to be empowered. Never let a physician make you feel like you're less than. Never let that white coat kind of reaching for the door make you feel that you cannot advocate for yourself and speak up, because it is that patient empowerment that will be the key to closing the gap in healthcare disparities in general, and certainly in healthcare disparities when it comes to long haul syndrome.
Thank you so much, Dr. Freda. As always, just a pleasure, always informative. You also hit on, some really important points. And as you were just talking about, the white coat going to the door and just about to leave, I always have to remind my parents, speak up. If you have questions, you need to make sure you speak up, and also the plain language piece is so very important. I mean, I'm educated. I've educated myself in medicine and in health inequities and social determinants of health, and there's still a lot of information that I don't know. So when I go in the doctor's office and I hear some things, and it's really interesting sometimes how a lot of providers on all levels, whether it's the nursing staff, the physicians, any type of allied health workers, some of them are in that space of speaking in their code all day, that they forget about the plain language. And you have to make sure that, as you are working with your community, as you're working with your patients, as you're working with your family, and speaking with your family, just to make sure that you tell them it's no shame in asking, can you break that down for me? You just said what you said and you understand that. That's wonderful. But can you bring it down on home so I can understand what it is that you just said? So thank you for bringing that to light, Dr. Fisher. So we are going to move on to our next panelist, which is Veronica Moore, and she is going to talk about the ACA and long haul.
All right, thank you. Thank you so much, Dr. Kelly. I appreciate this opportunity to be here. I want to thank the NCNW and all of those that are assembled this evening virtually for joining this really important conversation. I really appreciate all of the things that have been said so far by Dr. Brooks and Dr. Freda as it relates to really looking at the whole person, talking about the social determinants of health, really looking at health equity and all of those pieces, and arming our community with the ability to really go in and ask questions and not be afraid, and really understand that it's their health that is at play here, and they need to be prepared and not be afraid to ask the questions that they don't have the answers to. So thank you guys for the information that you shared. I'm going to talk really briefly about the Affordable Care Act, but there are a couple of things that I wanted to start off with as it relates to the ACA and kind of where we are. I know a lot of people think, surprisingly, that the Affordable Care Act actually went away, which it did not. But I want to point out a few things that are very specific to COVID and COVID long haul, the discussion we're having tonight. And in light of the rise of long COVID as a persistent and significant health issue, the Office for Civil Rights of the Department of Health and Human Services and the Civil Rights Division of the Department of Justice have joined together and issued some very specific guidance to address this issue, so that people who are suffering from COVID long haul, they know that they are still covered and are able to access and have adequate healthcare services and healthcare coverage. So the guidance explains that long COVID can be a disability under the American Disabilities Act. It's also covered under Section 504 of the Rehabilitation Act of 1973, and also under Section 1557 of the Patient Protection and Affordable Care Act, the ACA. So each of these federal laws protects people with disabilities from discrimination. This guidance also provides resources for additional information and best practices. So I really wanted to point that out. And then as it relates to the marketplace, if people already have coverage under the marketplace, under the Affordable Care Act, the rules in your marketplace health plan for treatment for coronavirus disease emergencies remain the same as any other viral infection. So it is still treated as any other pre-existing condition or any other health condition that you would have had and eligible to have covered as a result of COVID. So I just wanted to point that out and clarify that, because I know that a lot of people wonder and had questions about that. But as it relates, so when we talk about the Affordable Care Act, a lot of things have happened specifically as a result of the American Rescue Plan. There was a lot of money put into the budget to help provide some additional support and resources for folks that are looking to get covered under the ACA. So we know that across this country, we had over 50 million people that did not have health insurance coverage. We also know that people of color in particular were at the greatest risk of not having access to healthcare coverage. But some of the things that really stand out now as a result of the American Rescue Plan and some of the changes that have been implemented along with this funding that came along are that we have now lower prices, more choices, a longer period to actually get signed up for health insurance coverage, and an extraordinarily robust outreach plan. So right now, a lot of people that are signing up for health insurance coverage, believe it or not, they are actually able to find coverage for plans less than $10 or less a month. And it used to be a period back when the ACA first actually rolled out. There was a lot of complaints about, you get these really, really low plans, but they don't really cover anything, or there aren't really many doctors in these plans. A lot of that has changed now as a result of some of the changes that have been added to the Affordable Care Act. There are now more choices for people to choose from. There are over 213 health insurance plans that are now on healthcare.gov. There's an increase of about 32 plans more than there were for the new upcoming 2021, for this 2021 plan year. And then 18 states now have more participating in the 2022 plan than they had in the previous year in 2021. So there are a lot more choices, a lot more options for people to be able to choose and select a health plan for their health insurance coverage. Another thing that has changed is that we have now extended the enrollment period. It got really short the last couple of years. But we are now back to having an enrollment period that actually started on November the 1st, and it's running actually through January the 15th. So, that is really big deal, because people were trying to rush and not really taking the time to really look at the plans that were available to them, because they just wanted to make sure that they beat the deadline. But right now, the deadlines have been extended to cover people from November 1st to January 15th. They have time to pick up and select new insurance plans. So with that, I'd just like to add that just since November the 1st, over 2 million people have actually signed up for coverage. So that is really phenomenal. And we're really excited about the momentum that, has taken place as a result of a lot of the changes that have happened in the marketplace. Additionally, something else that's really important that I like to talk about also is, and Dr. Brooks hit on it a little bit earlier, is the expansion of Medicaid or not, depending on where you live. So a lot of people were left in what we call the coverage gap, because a lot of states, depending on, what their leadership decided, they decided not to expand the Medicaid program. So prior to this year and the changes that have happened, those folks were just left out in the cold. And oftentimes those were people that were lower income families or individuals that they couldn't qualify for Medicaid because, they made too much, or they didn't qualify according to the state's Medicaid guidelines. But then they also didn't qualify to get any of the subsidies that were available on the marketplace because of they fell into what's called the coverage gap. So now the benefits have been extended, and it used to go up to about 400% of the federal poverty level, where folks may be eligible to get some kind of assistance or tax credits to help them pay for their health insurance coverage. Now that is even extended beyond the 400% of the federal poverty level. So a lot of people that were actually left out and in the cold, not being able to access health insurance coverage, they can now get insurance through the marketplace and get assistance with paying those premiums now as a result of that. So we're really excited about those new changes that have come into place. Still a lot of work to do on Medicaid expansion, but we're excited that now the marketplace now has added some additional benefits to help cover some of those families. And then additionally, there is a really robust outreach campaign. We have a couple of different arms for people to actually get information and education around the marketplace. The NCNW, the Good Health Wins initiative, that's one arm. So we have organizations that we call champions for coverage. And we're hopeful that everybody on this call, if you're not already in your organization, want you to sign up to be a champion for coverage. And champions for coverage do something really simple. They educate their communities and make sure that the resources and the information is available to their communities about how to access health insurance coverage. And that's really, really important because, you know, a lot of people think that, you know, we have to be a navigator. We didn't qualify, you know, we didn't apply for this navigator funding, so we really can't do a lot to help people get signed up. You absolutely can if you sign up to be a champion for coverage through with the marketplace, and you are in a position to really get all of the information is there and available. I'm going to put a few things in the chat. There are templates, there are toolkits, there are anything that you need to build any kind of education campaign within your organization. Doesn't have to be very sophisticated. The resources are there, and I'll put those resources in the chat so that you guys can have access to that. Additionally, with this year, there are 4 times as many navigators as there were before. So I'm going to give you an example of how the increase in navigators went. Here in big old Texas, I'm here in Dallas. I'm based here in Dallas. So in Texas, we've had 2 navigator organizations for 254 counties. So with that, this year, that has increased. So we've gotten across the country, there are 4 times as many navigators that are available. It's approximately about 1,500 navigator organizations across the entire country now that actually got funded from HHS through CMS to provide enrollment assistance. So they actually sit down and they talk through and do the applications for families and individuals to help them get signed up for coverage. So that's really big. And to Dr. Freda's point, I wanted to just point out one of the things that we encourage, I know I do and my colleagues do when we're talking with our navigator partners, we really make sure that when they're sitting down and they're working with people to help them sign up for coverage, that we make sure that they help them look at, you know, who their doctors are, what doctors are in this plan that you're choosing. Are my medications covered under this plan? Are the hospitals that I need or want to go to a part of this plan? And then we also encourage them whenever the families sign up for these plans, that when they go and they hurry up and select a primary care physician, and when they go and see their physicians, that they are armed with the information that they need to be able to ask the right questions to make sure that they're getting the best possible health care that they're there to receive. Because a lot of times, as we know, that's already been discussed, you know, it's one thing to tell a person, here you go, now you got insurance, go ye and do and get, you know, go and now you're all good. And a lot of people have no clue what to do when they have insurance. So we really try to educate and arm people. And that's another thing that a lot of our champions for coverage are good at, is educating people. Now that you have insurance, here are the other steps that you should take to make sure that you are accessing all of the services and benefits that are available to you. Another thing that I want to point out, we in many forums, and we talk about healthcare, we talk about a lot of the physical ailments, we talk about diabetes, we talk about high blood pressure, obesity, all of these things that we know our communities are suffering from. But mental health and substance use are also covered on these health plans as well. So we need to we need to make sure that we're having conversations with people and letting them know, because you may run into somebody that, you know, well, I don't really have anything wrong with me. Now we can say yes, but everybody needs to have insurance and everybody should have a primary care physician. But a lot of people are really suffering, particularly as a result of the pandemic. And suicides have increased. We've had the highest number of overdose deaths ever this year. And it's mostly contributed to the pandemic. So we really want to make sure that people understand that, you know, we want to make sure that you're equipped to have coverage and support for your physical health, as well as your mental health and other behavioral health issues that a lot of the issues that our community face. So I just wanted to point that out so that when we're having these conversations, people understand that all of these things are covered. It's not just going to get your physical needs met, but it's also these behavioral health issues that oftentimes contribute to some of the other physical ailments that a lot of folks in our communities have. So I wanted to point that out. I've already talked over my time.
Right,
Oh.
yeah.
Okay, so that is all I had. I'm gonna close it out and make it really short. I'm gonna put the resources in the chat box, and I just want to thank everybody. And I really hope that you will join us in getting the word out and helping to arm our communities with access to healthcare and knowing how to use it and utilize all the resources that are available to them. Thank you so much.
Thank you so much. And, you know, there's a lot of good information that comes from the regional offices at HHS, as you can hear. And Veronica, I'm sure NCNW team would love to have some of those resources as well. I just also, before we go to the last presenter, I just wanted to put a couple of nuggets out there for people to look into. CMS has also extended their telehealth services and other diabetes and nutrition services and regulations so that providers can waive fees for adding on diabetes programs and things like that. It's a lot of great things that have come out of this disaster of COVID, and I'd love to encourage all of you to look up these things, because you know a lot of our community members don't know about that. They don't know about the new resources that are out. And one point to also remember that Veronica just talked about is the extended enrollment period. So January 15th, you know, get with you all are community leaders. I'm seeing a lot of D9 folks on the phone. I see a lot of organizations like Ladies of Distinction. You know, you are the voices in your community. So you are the trusted messengers in so many ways. So it's so important that you get out there and use those resources that the government has, that bridging that gap that that conversations kind of get cut off, you know, with government and the community. So I encourage you all to do that. So before we hear from Sharon Jackson on community resources, I just want to encourage you all to use the chat box. We have a wonderful forum happening. Some of you are already using it. And we have some fourth-year students, pharmacy students, with Sharon Jackson. I'd like to shout out Ms. Zelma Datu, and please forgive me if I botch your name. They are under Dr. Mccants, I'm sorry, not under Sharon Jackson, and also Ms. Basil Mbeli. So they are going to be working the chat box, answering questions about youth and long haulers and COVID issues. So feel free to use the chat box. After we hear from Ms. Jackson, we will be doing question and answer. So feel free to flood in your questions right now. So I'm going to turn it over to Ms. Sharon Jackson. And Sharon, I'm going to ask you to introduce yourself briefly to the audience.
Good evening, everyone. As you know, I'm Sharon Jackson. I am a public health practitioner, which means that I have a graduate degree in public health. And what I focus on as a public health practitioner is population health, how to keep the population healthy, whether that is collecting and analyzing data about various diseases and looking at processes and prevention, whether that is doing drug trials to find new drugs that work. So to get started, COVID is the most deadly pandemic of the last 100 years. There have been 4 since 1918, 1918 being the flu pandemic, and this is the most deadly. In addition to that, COVID has been a pandemic that has caused a lot of long-term disability, and that's what we've been talking about tonight, long COVID. The resources that we put together for you are meant to provide credible sources of information about COVID, about vaccinations, treatments, and also preventive measures. They also provide information about good health practices, weight management, nutrition. At this point, I am very pleased to let everybody know that right now we have 7 HBUs that have accredited public health programs or public health schools. This is a lot better than when I was going through my training. You will see the list of the HBCUs that are so accredited, and I would encourage you to go explore their websites, see what they have to say on various health topics. They are going to be a very good source of information for you. One aspect of the pandemic that has emerged, particularly in African American communities, is this idea of trying to get our arms around the idea of wellness, about health promotion. These are these are things that will reduce the impact not only of COVID, but also all the other chronic diseases that we know that we suffer from, hypertension, diabetes. One thing I want to truly focus on tonight are talk about some actions that anyone can take to improve their health. And also, these are things that will have you in good stead for being able to avoid COVID along with vaccination. The idea of having a robust immune system is very important in not only resisting COVID, but all other infectious diseases. We often hear professionals talk about health risks, and I want to draw a connection between some health risks that are associated with COVID, but also apply to other viral diseases like the flu. One thing that you can do to improve your immune system and lower your susceptibility to COVID is through good weight management. And I'm going to tell you why that's the case. Excess weight, it has a negative impact on immune function through 2 related but distinct biological processes. First, excess weight contributes to a decrease in optimal immune function by causing excess inflammation. Fat tissue leads to is responsible for an increase in the production of those biochemicals that cause inflammation. And as I said earlier, inflammation has a negative impact on immunity. Second, excess weight increases the risk of several other important chronic diseases, such as high blood pressure, diabetes, cardiovascular disease, things that we have talked about before, which independently of excess weight by itself also have an adverse impact on immunity by causing inflammation. We hope these resources that you can see will provide good information on nutrition for optimal weight management and also inform you about those essential nutrients that you need to consume in your diet that help immunity. They also will provide information about lifestyle choices that will help promote health. We hope this will help our community and others live their best and their most healthy life. One of the saddest things I've ever heard in interacting with members of the community and talking about health came from actually a young lady in her early 30s who said that, well, of course, we're all doomed to suffer from chronic diseases. That is not true. They can be avoided. It does not have to be this way. We hope that by exploring the resources that you find on what we've provided, in addition to exploring the programs and the schools of public health within the HBCU community, that they will show you how to achieve your best life in health. Thank you.
Thank you so much, Ms. Jackson. I mean, we have heard so many great things today, and I think you just really rounded it out with, you know, prevention, in addition to vaccination, and doing things for yourself, like helping to build your own immunity and improving lifestyles. You know, there are simple changes that we all don't even realize that we can involve ourselves in to help ourselves get healthier, so that when the next pandemic rolls around or anything else, you know, our bodies will be stronger and able to fight disease better. Just simple things like raking your lawn. The other day I was looking and I saw that a lot of those leaf blower machines are just prevalent in my neighborhood. I mean, everybody's blowing a leaf and sucking them up with whatever the contraption is. And I just thought about, if those same people would get a rake and just start raking those leaves, you know, that would be physical activity that could help, you know, to improve health or their health outcome in the future. So just thinking of small things like that, small adjustments just to get yourself active and making better choices, you know, not necessarily cutting out the junk food, because we all know that we all want some good cake and some good chips and fried chicken or whatever it is that we love to eat, but learning how to do it in moderation. And I think that those are key points, Ms. Jackson, that you brought up in actions to improve your health. So again, thank you so much for the information you provided. So we are going to transition on to Q&A. And Dr. Marilyn Brown is going to assist with this. As you all know, I'm still having computer issues. That's why I'm not on camera, and I'm receiving a lot of the chats via text. So Dr. Brown, would you like to kick it off, or do you want me to kick off the first set of questions?
There's a question that I actually saw in the chat that I would like to know information about. So this first question comes from a participant who asked, what about the other information that is getting published about not getting the vaccine?
Yeah, I saw that, and I wanted a little more clarity about what the other information is and what exactly. I didn't really understand the specifics of the question.
The presumption is that it's myths and misperceptions. I mean, I'm guessing that's what it is.
Yes,
So
Dr. Brooks.
we know there are a lot of them, but just being very clear, they generally are untrue. Doesn't cause infertility. There is no government conspiracy that we know of. They're not tracking you with some nanochip. Whatever else is out there. Those things are all inaccurate. The vaccine can cause the disease. I think most of us know that. Would be considered disinformation, purposefully incorrect information.
I also want to add that you're not going to turn into a human magnet either.
Ooh, I was worried about that.
I definitely agree with Dr. McCants and Dr. Brooks. I think, that's part of the misconception that we're seeing, some of the myths about the vaccine. And, I think it's going to be up to us as healthcare professionals to really educate people and really enlighten them on, some of the facts and not some of these myths. So, I think it's going to be key for us to do in the future.
And it doesn't integrate into your DNA. I knew there was another.
Yes, thank you so much, Dr. Brooks. Just moving on to the next question. We want to make sure we have enough time to cover all the questions here. There's a question that came up. What are the long-term effects of COVID-19? And once you have been quarantined for 2 weeks, does that mean you cannot spread COVID-19? And any of
Hi.
the doctors like no.
So for some of the long-term effects, and we talked about some of them tonight, you can get fatigue, you can get shortness of breath, you can get something called POTS, where you get a tachycardia or a fast heart rate. You can get brain fog, which is pretty nonspecific, but where you simply forget things, not just, where are my keys, where are my phone, but people's names, like your children, or people's names who are really close in your life. You forget certain routines, and you're not a person who prior to that had any cognitive malfunction or any dementia, but people are getting that. You can also get something called Guillain-Barré syndrome, where you have literally a paralysis. You can get strokes. You can have long-term difficulty breathing. You can have kidney failure. I have patients I put on dialysis during this pandemic who had no kidney problems before, but after having severe COVID-19 disease and having multi-organ failure, meaning their lungs failed and they had to have breathing tubes down their throats, their systems failed where they didn't have a high enough blood pressure to sustain life, and their kidneys failed. I have patients right now who are on dialysis as a long-term effect. Infertility from COVID-19, the disease can occur. We have found that COVID-19, the disease in pregnant patients, has been more associated with pregnancy loss or with preterm delivery. And so it's the disease, not the vaccine, that has been associated with fertility issues. I could go on and on and on, but these are some of the long-term complications. And that's why I think that it can be so frustrating for those of us who are trying to spread evidence-based information about COVID-19. We look and we see the almost 800,000 people who have died from COVID-19 in this country. We see the over 48 million confirmed cases. We see the over 6.4 million infected children. We see all of that, and we know that that's the reality. That's the true information about what the COVID-19 disease can cause. And now we have this Omicron variant, and it's still a guessing game. We're not sure. But these are all some of the long-term effects of COVID. But of course, the best way to prevent them is to get vaccinated if eligible, and to get a booster if eligible. That's our best strategy.
Thank you, Dr. Freda. And, another part of that as well is, don't forget about the mask. I think a lot of people have just kind of laid the mask down and said, well, I'm vaccinated, or this thing is, kind of dwindling out, so I don't need to, necessarily wear a mask. I had to tell my family members, when y'all come to my mom and dad's house for Christmas, you need to have your mask on unless you're eating, and then put it right back on afterwards. And I think we all get a little comfortable with everything, and it's really important to make sure that we remember those things. And even the, socially distancing, it's something that we should still practice. Having dinner outside. My people are from Louisiana, so warmer climates in December, around Christmas is a possibility. So doing things like having dinner outside, Christmas dinner outside, so we can all continue to think of safer practices so that we are being safe during this time. And Dr. Freda, there was a request for you to put your YouTube channel in the chat box. So if you could do that, there was.
Yeah,
oh,
we've
it's there. Okay.
done it. Yeah.
Okay. Oh,
Thank
perfect.
you.
Okay. Good job. Perfect.
Can
Okay.
I answer one question real quick? I'm sorry to interrupt. Sure. So Spencer had a question about any data regarding people that have had breakthrough infections of COVID-19 that end up with long haulers. Again, we still have to remember that we are still learning, right? So the Omicron variant, there are 2 cases currently, one in Michigan, one in California, I believe, that they are still learning about what this variant does. But what from my experience, I take care of COVID patients in the ICU, and lately in the last, I'll say 2 weeks, we are getting people that are coming back that have recovered from COVID-19. And I admitted 3 patients with irregular heartbeats. But that's because it was recognized by me because I'm indwelled in this topic. There are so many other signs and symptoms that people just don't even understand or know, like having lung problems, having asthma, having brain fog. The two most common mental health side effects from long haulers is anxiety and depression. Can you imagine how much that is dismissed and forgotten? So I just wanted to say that please remember that we are still an evidence-based community. We are still studying the effects of this. There's only one study that I know of, and Dr. Freda and Dr. Brooks, you can correct me if I'm wrong, but it's called the panel study from a clearinghouse of insurance agencies that pulled some information about COVID long haulers. And as of to this moment, I don't know of any studies that can give us specific statistics about your question, Spencer, and any breakthrough cases with long haulers, because I haven't seen any. Dr. Brooks or Dr. Freda, do you want to follow up on that?
I haven't seen the studies, and that's the issue. And then think about adding to that the inequities or the disparities if you look at the studies. So data is crucial, and we don't have it.
I agree, because you'll see numbers that range from 10% to 60% of people with long haul, and then how they define it differs because it's not just a homogeneous disease. You're talking about many different diseases. But I do want to say, Dr. Elgin, I love that you mentioned the mental health aspect, because when we've been talking about the health disparities with long COVID, I know I largely am focusing on the systems part, fault and systemic racism and barriers in healthcare access. But we often have, as a culture, barriers ourselves, and it's specifically with that anxiety, depression, mental health part. A lot of times in communities, if someone goes and shares, I am depressed, it's seen as a sign of weakness, and you're just told, oh, go pray it away. Oh, that's just the devil. Yes, do pray, but also understand that we have mental health access now. So I'm glad you highlighted that, Dr. Elgin.
There's another question. Someone asked, what if you had all the symptoms, but your test was negative and you took about 5 tests, yet you were sick for 2 months?
Well, that's slightly different than long haul if you're now well after the 2 months. So technically long haul symptoms 4 weeks after, but they only lasted 1 extra month, you're lucky. I would say that the test tends to be accurate. If truly you get tested when you were sick, then the test, based on the test that they use, the PCR is accurate at 98%. So it may in fact be that that person just did not have COVID and they had some other condition. But these are the challenges of medicine that we actually all face every day. There's not a clear answer to that question.
That's true. And just because we have COVID-19, all the other post-viral syndromes and chronic fatigue syndromes, those didn't go away. Exactly. So yeah, it could be non-specific. And then also we're learning with long COVID that you can have a very mild case of COVID where maybe you didn't know you had COVID. And then 4 weeks later, you can still get long haul, but then you may test negative even for PCR if you've already passed that window. So it's complex. And so as we give our advice, also for the folks who are asking questions, please don't let our advice replace your own healthcare provider, your own physician who can actually see you and do an in-depth history and physical. So yeah, make sure you see a primary care doctor.
The next inquiry is one of advocacy. How does someone sign up to be a champion for coverage? So, Sora Moore.
Hi, thank you. I put in the chat box a link to that, but there is a link on the CMS marketplace.gov website that gives instructions on how to sign up to be a champion for coverage. And with that will come event in a box, toolkits, and all the resources that you need to help support education and outreach in your community. So I can drop it in one more time, but it is on the marketplace.cms.gov website. It's right there, but I'll drop it in one more time.
And this is a recurring theme. Where can everyone see a video of this wonderful presentation? Because they would like to share with tons of people.
I'd be happy to weigh in. We will upload the recording onto the Good Health Wins website that's located at goodhealthwins.org. And we will also hopefully link that to our NCNW website as well. So as well as all of the information that we're seeing in the chat, those resources will be linked to our resource section on our website.
Thank you so much. Another question came in to the chat. Now, this is a really good question. How do we know what the actual real life long-term effects of COVID have been and are? The reason I ask is because many people who have poor or no insurance are not able to be followed by a COVID specialist or long haulers clinics.
I want to take a stab at that. I think at this point in the game, I think your best alternative is going to be with a pulmonologist or an internist, depending on what type of symptoms you have. Again, I know that COVID long haulers is a new term and it's new to the medical community. So I can't express enough how we have to tell all the participants on the town hall that this is the beginning, right? So as time goes on next year, I am going to guess that COVID long haulers will still be a topic of discussion, but as we continue to research and study the statistics of what it looks like, how people are being affected, thereby we'll be able to ask for and advocate for more community resources. So these kinds of forums are so very important, which is why when we were brainstorming what this looks like, I said that the one thing that I want people to walk away with is a community resource. So I put those things that Sharon Jackson had talked about in the chat. So I'm hoping that you were able to receive that information. And if not, Synovia, let's get together and see how we can get that information to our participants. But remember again, please, the most important thing to get out of this town hall, if you don't get anything else, is report it, stay consistent about your symptoms, advocate for yourself and your families, and continue to say, I have these symptoms, I don't understand. Even in the mental health community, continue to advocate for yourself or get some type of advocacy on board for your family and yourself, and continue to say, I am having these issues. Now, I'm about to get into an area where it may be a little controversial, but my friends, the only way that we're going to figure out all of the questions that you're having is that we need to participate in research, right? There are a lot of angst against people that look like us that don't want to participate in research. But these very questions that are in these chat rooms are the very reasons for why we need to participate in research. There are too many things, too many stopgaps that I'll say that are in place where all of those things that used to happen in the past cannot happen anymore. But if you feel that you are not being heard, if you feel that you are not being represented, there are also means to voice your opinions and advocate for yourself in that situation as well. They cannot discriminate against you in a research project, but the only way that we're going to learn how this affects people that look like us is to get involved in that research. So please, that second piece that I want you to remember is if you see something that's about long haulers and it's a research study, please, please get involved. I've taken too much time, but thank you.
Thank you, Dr. Elgin. There are two more questions. Well, I don't know if someone already answered this one, but one is one COVID vaccine better than another? Was that answered already?
No, not that I heard. And the general answer is they're all effective. And I wouldn't think along those lines. There may be reasons why you choose one over another. You may have needle phobia, so you only want to get one shot. So you get the Johnson & Johnson, or if you're a young male, you may be a little concerned about myocarditis, get the Johnson & Johnson, or woman may stay away, go get the mRNA vaccines because they're worried about TTS, cytopenia, and thrombosis syndrome. But all these complications are extremely rare. My statement when I've been asked that I get, yeah, you choose the one that is closest to you. If one is 3 miles away and the other one's 5 miles away, go to the one that's 3 miles away. Because and the bottom line is that we need us to get vaccinated. Our people need to be vaccinated. We have the lowest rate of vaccination, highest rate of hospitalization, death, disease, transmission, you name it. So just go get vaccinated.
So I wanted,
Thank you for, oh, go ahead, sorry.
yeah, so I wanted to add on to that. And good evening, everyone. I'm Tamara Mccants, and I'm a pharmacist and assistant professor at Howard University. And we have been responding to COVID since the very beginning, from March 2020. And just to add some more information about the vaccine. Well, the first thing that I want to say is that I'm glad that we're having a conversation. And by no means do I feel like just by us having one conversation that we're going to just change your mind if you're a skeptic, because we have reasons to be skeptic against the healthcare system. And I think another thing that we're not talking about is just the oppressed people and their ability to choose. Some people are just not taking a vaccine because they feel like that's one of the few things in their life that they have an opportunity to choose. And I heard that quote unquote from somebody that's actually in prison at this time. So I think it's some of those social nuances that we need to talk about and that we need to recognize in the Black community as to why our people are not getting the vaccine. And we need to be able to give people science-based, evidence-based, I heard that term several times, information and facts to combat all of the misinformation that is happening right now. And I understand why people are confused about the vaccine, because when the vaccines were first approved, they were 3 different endpoints for 3 different vaccines to be approved. So we cannot compare which one is more effective, because in the studies, they didn't have the same endpoint. But all we know is that all of the vaccines, we know a couple of things. There is no documentation that anyone has ever died from getting the COVID vaccine. Notice I'm using my words very carefully. There's no documentation. We don't know if it has happened or not. It hasn't happened. The second thing is that we know that vaccines prevent COVID deaths, and we know that vaccines prevent decreased hospitalizations, and vaccines decrease severe disease. That's what we know. And that is evidence-based, and that is what we have data for right now at this moment. So the best vaccine is the vaccine that you have access to. And I also want to just give some perspective in resource-limited countries where they don't have access to 2 doses. So they're getting 1 dose of the Moderna, 1 dose of the Pfizer. A booster is not even an option for them. And they're waiting in line trying to get the vaccine so they can be protected. So we know is that if you get the vaccine, that you're not going to die from COVID. That's what we know today.
Okay, we have to end there. Thank you so much, Dr. Mccants, for being here. And thank you to your 2 doctoral students as well as being here. Thank you so much. I'm going to turn it back over to Dr. Kelly.
Yes, thank you so much, everybody. It has been a pleasure moderating this panel. And like Dr. McCants said, I believe Dr. McCants said it, this is not just a one and done conversation. This needs to keep happening. I just want to, extend my thanks to all the audience members who came. You again are voices in your community. You are the trusted messengers, and, just keep doing what you're doing. We're here as government resources, community resources. So I left them put my email in the chat, but my computer's down. So I hope that you all can connect with us as you need us. We are here for you. And thank you, NCAW, for inviting me to moderate this panel. I'm honored to be a part of it. So thank you all. And I'll turn it back over to the NCAW team.
Okay, thank you everyone for coming. We are going to close with our chair from the ACA Subcommittee of Health Equity, Ms. Barbara Hatcher.
Good evening, everyone. On behalf of the Affordable Care Subcommittee, I thank you for joining us this evening for this important discussion about long COVID. It has been a powerful discussion. Our subcommittee is pleased to co-sponsor this event, and as speakers have highlighted over the course of this discussion, it is important that we advocate for affordable care in the U.S. and to push to make certain that those with long COVID are able to get the care they require, whether it's for prescriptions or treatments or their insurance. So again, thank you for participating this evening. I will turn it back to you.
And Synovia, I believe you have a surprise for us.
Well, I just want to say on behalf of the National Council of Negro Women, our president, our chair and CEO, Ms. Janetta Besh-Cole, on behalf of our executive director, Janice Mathis, the NCNW team, the Good Health Wins Committee, we really want to thank you all for joining us tonight. Thanks to NCNW, to our Health Equity Committee chaired by Shara Denton, to our NCNW Health Equity COVID Subcommittee. Thank you, Dr. Elgin. Thank you to all of the members of the COVID Subcommittee for being the chair. Myself, it's been a pleasure to serve as co-chair of this committee. And a special thank you to Sharon Jackson. We had the opportunity to co-chair and work with the ACA team to pull together tonight's national webinar. Ms. Mathis, our executive director, often says health is wealth. And tonight we have truly learned so much from our distinguished speakers about the importance of good health. And it has been a wealth of information. Thank you to Dr. Oliver Brooks, to Dr. Freda, to Veronica Moore, to our moderator, Jonetta Kelly. Thank you to each and every person who took the time tonight to be a part of this national webinar. If you'd like to get additional information about the National Council of Negro Women, you can do so at ncnw.org. Tonight's recording and our resources will be available on the Good Health Wins website at goodhealthwins.org. As we often say with Good Health Wins, we are better together, and together, good health wins. Thank you and good night.
Right. Thank you.